Today is day 7 of the Allina nurses' strike at 5 Allina hospitals. 4,800 nurses went on strike on Labor Day at Abbott Northwestern, the Phillips Eye Institute, Unity, United, and Mercy hospitals. They have been unable to reach a new 3-year contract with Allina Health. The main issue has been their health insurance policies. Last week, a representative of the nurses union was a guest on this show, and this week we are pleased to have the CEO and president of Allina Health, Dr. Penny Wheeler. Thank you so much for coming in.
Good morning. Thanks for having me, Esme.
Dr. Wheeler, I want to ask you about the health care. What is the status of your care at your hospitals? I understand that you have a situation where your own child, your teenage daughter, actually had to be hospitalized during the strike for a number of days. She thankfully is doing well, but what was the kind of care she received?
Well, how ironic is that my daughter has a first hospitalization during the course of the strike. And, our first commitment is to the quality and safety of our patients. That's always the first commitment. And I got to see it up and close and personal, not only as somebody who supports the care in our organization, but also as a mom this week, and it was exceptional.
All right. The nurses told me this morning that after the talks broke off, they actually said that they were willing to go back to the bargaining table. What about that?
Well, first of all, let me just say that the talks were productive. There's a lot of things over several months to which we agreed. We agreed to new hiring practice that streamlined it for nurses. We agreed to tuition reimbursement. We agreed to scheduling changes. We agreed to workplace safety things, including 24-hour security in our emergency rooms. And we agreed to extend the transition to our health plan until 2020, when the Cadillac tax for these expensive plans comes in. So there's much to agree. So quite honestly, it puzzles me, and it's really disappointing that that strike is what was chosen. I would say that they've said that they want to get back to the table, but we have not been contacted, nor have our federal mediators. And right now, our focus during the strike has to be on the quality and safety of our patients. So unless those are very serious gestures, we have to focus on quality of care given this disruption.
All right. And this is a health plan, the transition you want to make is to this health plan, and that's the health plan you have. Yeah,
that's a core plan that all of our 30,000 employees and their family members essentially have. And it was co-designed with our environmental service workers, to make sure that it would support them in the best way, and when they make half the wages that our nurses make. So it's a really good, rated as a Gold Plus plan for those of us who have it. The rhetoric around financial ruin and around bankruptcy, just quite frankly, is untrue. That's not what we experience with all of the rest of our employees.
Right. Allina has made a number of points about being stewards of the Allina institutions, financial stewards, yet it appears that you're spending $20 million a week on these replacement nurses. Is that really being a good financial steward here?
Well, it's, I think to be financial stewards right now is more important than any time, given the changes that healthcare is going through. It's important to be very, very good stewards. We know that the ongoing costs of these health plans especially are year after year after year after year costs, including the 40% tax that's proposed in 2020. Those are exorbitant costs that are going to occur. So this is a one-time cost, and it's very costly. We didn't choose for this cost. We tried to do everything possible to avoid a strike. Nonetheless, that was a choice of the Union 2 strike. So while we didn't choose these costs, they are costly. And what we're trying to do, quite honestly, is work together to a better day where we can make healthcare better and more affordable for everybody. That's going to require us all to work together and think about healthcare in a new and better ways.
As I understand it, the nurses were willing to transition if there was some kind of monetary payment to them during that time. Is that not an option?
Well, I think that some support is an option. Remember, a bunch of nurses will save money going on these plans
the premiums
going forward.
On a number of these plans are actually lower. I did look at that.
They are. But I think we have to look at
out-of-pocket costs they're worried about.
I think what we had to look at then is what's a total package for our nurses? Are we being fair to our nurses? Are we being fair to all the rest of our employees in this? And the total package for nurses is very competitive nationally. They're paid 30% above national average, 5% above markets like Phoenix, New York, Atlanta. So the total package for our nurses is quite healthy, and it should be. They're really, really good. So that's important that it be good, but we had to look at the total package rather than looking at one trade-off for another.
Okay. And no new talks scheduled, right?
No new talks scheduled. We'll be anxious for them. If there can be serious talks scheduled, we're ready. Otherwise, we're going to focus on the safety and quality of our patients right now.
All right. Well, Dr. Wheeler, thank you so much for coming in.
Thank you. Really appreciate it.
All right.